Welcome to CPE-HR presentation on healthcare reform and the individual mandate. Today's presentation is going to focus on one aspect of the healthcare law, and that's the individual mandate. One comment I leave employers with is that there's a great deal of work that's still emerging relative to the healthcare reform law, guidelines, provisions, and changes that are constantly being updated and released. So I encourage everyone to continue to monitor these developments and look for the changes as they come out. Today's presentation that you've selected is on the individual mandate, and we're going to focus our attention on that aspect of the healthcare law and how individuals are required to provide coverage for themselves. A couple of key points that I'd like to start with, and that is emphasizing the major components of the healthcare reform law. And the first one is the subject that we're going to speak about today, and that requires all U.S. citizens and legal residents to have health insurance or pay a penalty. Another key component of the law is that coverage is guaranteed issued, no pre-existing condition limitations, and that begins January 1st of 14. So for the first time in most health insurance markets, an individual can apply for health insurance coverage and be guaranteed that coverage will be issued to them. The law creates a state-based marketplace called the exchange, and we're going to spend a little time talking about that because this is the place where individuals would go to access information about the individual health insurance that they're required to purchase. The healthcare law also establishes premium credits and cost-sharing subsidies for low-income individuals, which we will also comment in today's presentation. The law expands eligibility for Medicaid. In California, it's Medi-Cal. This is a substantial expansion in the eligibility definition and will allow some 17 million people nationally to access Medicaid for the first time. The law does not eliminate the current individual market or COBRA requirements that have been in place for many years. The next slide is a slide that helps present some information about the premium subsidies and credits. And on this information indicates that the Medicare eligibility is going to be set at 138% of the federal poverty level, and individuals eligible for Medicaid below this income level will essentially have access to the federally subsidized Medicaid program. For individuals with low income above 138% to 400% of the federal poverty level, these individuals will be eligible for a premium subsidy. And for an individual, that means someone with income based on the 2013 federal poverty levels, incomes between $15,856 and $45,960. These individuals will be able to apply for health insurance coverage on the state exchange and, based on their income, be eligible for a premium subsidy to help pay for health insurance. The subsidy is directly related to the income level, and so it's greatest at the lower level and lower as income goes up. The family of four income range would be $32,499 all the way to $94,200. Again, these are 2013 figures. They'll be updated slightly for 2014. One of the things that we'd like to emphasize when an individual is considering purchasing health insurance and anticipating qualifying for a subsidy is the employer mandate in the law includes a provision that says that if an employer provides employees with affordable coverage, and that means it meets certain requirements of the law, then the employee and their dependents are not going to be eligible for a subsidy. This is an important provision that needs to be communicated to employees, and in fact is included in the notice required to be given to employees. The affordable rules for an employer is that their plan must have a 60% actuarial value and cannot cost the employee more than 9.5% of income. So those are the parameters an employer needs to meet. If an employer's plan doesn't meet that requirement, then the employee and their dependents are eligible for subsidies. If the employer's plan does meet this affordable test, then the employees are not eligible for a subsidy. Below is just some information about the federal poverty level in 2013. For an individual, 11,490. In Alaska, slightly higher, and Hawaii, slightly higher. And then the family of four information is also included. At the back of the presentation, we have a reference document that gives the full table of the federal poverty level based on family size. Now, the individual mandate requires that individuals provide themselves with health insurance coverage, and if they don't, they are going to be subject to a penalty. Now, the penalties are phased in over a number of years. Beginning in January of 14, the penalty is $95 or 1% of adjusted gross income. It's going to be the higher of those two amounts. So most people will likely hit the 1% of income level in determining if a penalty is due, because they didn't provide health insurance coverage as required. In 2015, the penalties increased to $325 or 2% of adjusted gross income, and then again in 2016, $695 or 2.5% of adjusted gross income. Thereafter, this penalty structure is subject and indexed to inflation. The penalty for children is half the amount of the adult, and there are family caps and limits on how much a family can be penalized for not having coverage. The law requires that an individual have coverage for at least 9 months in the calendar year, and if they have coverage for less than 9 months, then they're going to be subject to the penalty. The penalties will be applied as a monthly amount, and it will be incorporated into the tax filing that each individual makes at the end of the year. There'll be a line item on the tax return that determines whether a penalty is applicable or not. Now, important aspect of the healthcare reform, specifically to individual coverage, is the creation of state-based health exchanges. So every state is required to set up an exchange. Some are setting up their own, like California. Some are using a state and federal partnership exchange, and others are relying on the federal government to run their state exchange. The exchange plays a very large role in administering this healthcare law, especially related to individuals and small employers. It will function as a marketplace where individuals and small employers can access information about healthcare plans available in their state. The exchange will provide consumer assistance, help individuals select plans, process applications, work to determine an individual's eligibility for enrollment, for premium subsidies, and generally manage the administrative requirements of the healthcare law in their state. Exchanges will be open for enrollment October 1st of 2014, and they'll be fully operational by January 1st of 14. In California, our exchange is called Covered California. In fact, it's up and has a website. You can go to it and look for certain information about plans available in California. There's a calculator on this site to help you estimate what premium subsidies you might be eligible for based on income level, family size, and benefit plans. The open enrollment begins October 1st and ends at the end of March 2014. The state exchange will be offering benefit plans from a number of health insurance carriers in California, and they'll be offering plans often referred to as the metal plans: bronze, silver, gold, and platinum. These plans have increasing benefits based on the actuarial value of the plan, 60, 70, 80, and 90%. There'll also be a catastrophic plan for children and young adults under 30 that will be available to them. The exchange does have an open enrollment period, and that individuals must apply for coverage during that open enrollment period, and if they don't, then they're going to be subject to access based on having a qualified event. They just won't be open to everybody. It will be determined based on a certain set of criteria. And employers must provide all employees with a notice of the exchange detailed by October 1st of this year. So individuals and employers will be distributing information about the exchange. The federal government has given us a model template. It's about 1.5 pages, and it provides a summary of what's available under the law, and it requires that the employer provide some contact information on that exchange notice. This next slide gives us a picture of, well, how are the states aligning around their responsibility for providing an exchange marketplace. The dark blue are state-based exchanges, where the state is taking on responsibility for running the entire exchange, as California is with their Covered California. And there's about 16 states and Washington, D.C. that will be running their own state exchanges. The medium blue, Iowa, Illinois, Arkansas, Michigan, West Virginia, these are going to be states which partner with the federal government and create a partnership exchange to help comply with the law. And then in the light blue, these are the states, 26 have elected to not establish their own exchange and relying on the federal government to manage the exchange, make coverage available in these states. If you're an employer with employees in various states, it's going to be critically important that you have some understanding of what exchange platform and access points are being established in those states for your employees. It'll be important because employees will be asking for some guidance about, what do I do in Kansas, or what do I do in Montana? What are my options in those states, and what are the costs for coverage? Even if you're offering a plan, employees may want to look at what's available in the state and make a decision to participate in your plan or purchase coverage on the exchange for themselves as individuals. Then the next slide is a list of contacts at CPEHR. This is their benefit team. These are employee benefit specialists, and they're available to answer questions you might have about healthcare reform, some of the law's requirements, including some of the law's administrative implications for employers and what employers have to do to be compliant, and what they need to do to put into place to make sure that they're providing the right level of compliance with the law. So I encourage you to contact CPE. The last page is the 2013 poverty guidelines that I spoke about earlier. These will change in 14, but this is the information we have available, and it shows the income levels for an individual or families from 2 to 8 and above. Thank you for participating. If you have any questions, please contact CPE.